Hello and welcome to Medical Dialogues, your daily dose of health and medical news. I'm Roshni Dhar. Let's look at today's top headlines. Remove two-finger test from medical syllabus, train HCPs on appropriate procedures, Supreme Court slams government. The Supreme Court on Monday deprecated the regressive and invasive practice of the two-finger test on rape survivors and said it has no scientific basis and instead re-victimizes women who may have been sexually assaulted and is an affront to their dignity. The two-finger test is conducted on victims of sexual assault and rape to determine whether they are habituated to sexual intercourse. The top court said it is patriarchal and sexist to suggest that a woman cannot be believed when she states that she was raped merely for the reason that she is sexually active. It said any person who conducts the two-finger test or per vaginum examination in contravention of the directions of this code shall be guilty of misconduct. A bench of Justices D.Y. Chandrachud and Hima Kohli made the remarks in a judgment on a plea of the Jharkhand government in which it challenged the acquittal of one Shailendra Kumar Rai alias Pandav Rai of rape and murder charges. The top court overturned the decision of the High Court and upheld the trial court order holding Rai guilty of rape and murder and awarded him life sentence. NEET PG Counselling 2022 MCC puts mop-up round on hold. According to a recent notice, the MCC has informed that the mop-up round of NEET PG Counselling has been put on hold as many PG diplomat of National Board institutions have taken offline admission of candidates. In its notice, the MCC stated that this is in reference to registration for mop-up round of PG Counselling 2022, which was scheduled to start from 31st of October. However, many PG DNB institutes have taken offline admissions of candidates for round 2 of PG Counselling 2022. Metformin improves clinical and metabolic parameters of women with PCOS. Metformin usage has beneficial effect on polycystic ovary syndrome women by decreasing body weight, total testosterone, BMI, fasting blood glucose, and raising the chance of pregnancy, according to an article published in Therapeutic Advances in Endocrinology and Metabolism by Sage Journals. With a frequency of up to 20%, polycystic ovary syndrome is a diverse endocrine disorder that affects women of reproductive age. Menstrual abnormalities, polycystic ovarian morphology, and excess androgen are biochemical and clinical hallmarks of PCOS. The primary glucose and lipid homeostasis cell regulator AMP activated protein kinase, which is stimulated by metformin, decreases hepatic glucose synthesis. Inhibition of glucose in the hepatocytes is linked to AMPK activation. Research was done to conduct a thorough assessment of the literature on the therapeutic effects of metformin on the clinical and metabolic parameters in PCOS affected women. Doctors leave cotton pad inside patient during C-section. Holding the Christian Medical College and Hospital in Vellore of guilty of medical negligence while conducting caesarean operation on a woman, the District Consumer Disputes Redressal Commission has recently ordered the hospital to pay Rs 15 lakh compensation. While conducting the C-section operation back in 2015, the doctors allegedly left a cotton pad inside the body of the woman. Further, the Consumer Court noted that the store records of CMC had been tampered. Therefore, the hospital has been directed to pay the compensation within 45 days. If the hospital fails to do so, an interest of 9% shall be levied on the compensation amount. That's all for today. Stay safe.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.